Welcome back, friends. Now we will discuss about the different diseases occurred by the airborne infections. In the last video, we will see about the what are the airborne diseases, their types, then droplet infections, then respiratory tract infections, and different diseases. Name of the list of the diseases of airborne and droplet infections. Now we will study about the different diseases. Then measles. Measles is the airborne disease. This measles reported near about the 700 years ago. Then the first scientific description of this disease and distinctions from the smallpox attributed to the Muslim physician Ibn Razi, who published a book entitled Smallpox and Measles. In this book, the Muslim physician Ibn Razi wrote about measles and the series of the disease according to the WHO. It remains a leading cause of death among the young children globally. Most of the children's death by this disease, and where about 1,97,000 people died from this measles in 2007, and mostly the children under the age of 5. And by this measles, the near about 20 million people affected every year, and the most of the travelers and expatriates are caused are these peoples have the measles mostly common commonly found the measles commonly found in the travelers and expatriates. This is the common uh, knowledge regarding the measles. Then positive agent of measles is an infection of respiratory system caused by the virus, and most important virus is a paramyxovirus of the genus morbillivirus. Which one is the genus is the morbillivirus. And then now the transmission of this is through the respiration. This contagious virus, which one is the virus? Paramyxovirus is a contagious virus spread by coughing and sneezing. Also, close person contact or direct contact with the infected nasal or through secretion. Then the infection has averaged their incubation period of this infection of this disease is near about the 14 days, range up to the 6 to the 19 days. What is the exact average incubation period of the positive agent is the positive agent is 14 days. Average incubation period of the infection is 14 days, near about the 6 to the 90 days. And then infectivity lasts from the 2 to 4 days prior and 2 to 5 days following on the onset of the RAS. This is the transmission. Then next one is the chickenpox. Chickenpox is mostly found in children again. Then chickenpox is caused by the varicella zoster virus. Which one? Varicella zoster virus. If you have chickenpox, this you can spread it for a day or two before you get the telltale rash. That is the skin is reddish in color and irritated. It takes up to 21 days after the exposure for the disease to develop. Then most people get chickenpox only once, and then the virus goes dormant. Then this virus reactive later in life, you get a painful skin condition called shingles. Called shingles. Shingles means it is the painful reddish. It is the painful reddish color skin rashes found on the skin. This is the shingles, and shingles is also caused by the varicella zoster virus. And if you haven't any chicken pox, uh, if you haven't chicken pox, you can contract it from someone with the shingles. Someone with the shingles. Shingles means it is a disease caused by the varicella zoster virus. Also shows the reddish rash or painful rashes on the skin. Then mumps. Mumps is one of the another very contagious viral disease, and it can spread it before the symptoms appears up to the 5 days after. Then little mumps is a very quite common disease in US, and the rates have declined by the 99% and trusted sources due to the vaccination. Then in the 2020, January from the January 1 to the January 25, the 70 cases found in the United States, and these cases reported by the CDC. CDC is the Center for Disease Control and Prevention. Central for Disease Control and Prevention. This is mumps is a very contagious viral disease and mostly found in the United States. The next one is the tuberculosis. Tuberculosis is caused by the bacteria, not the virus. Okay, then it's spread by the droplet which are expelled by an infected person. That is by sneezing, coughing, laughing, talking. Uh, the droplets are produced and which are expelled by the infected person. Then TB is not a highly communicable disease. Then risk of this exposure is based on the time with the infected person. If a ventilation was present and any prevention measure that were used, then exposure time is between the 2 to 10 hours in an unventilated confined space. Then TB infection whenever positive on the test but no disease. Test will be the positive, but infection that is no disease, then cannot pass on the disease. Then there is no need for the repeat testing or chest X-ray unless you develop any symptoms of the TB infection. But in TB disease, what is TB infection? Test is positive but no disease. And in TB disease, positive test, then positive X-ray, positive lab data, all positive. Then may be able to pass disease on. That is the TB disease started on. Then if the following an exposure you test positive, you may be offered a drug treatment lasting 6 to the 9 months. Then you take the near about 6 to 9 months of the uh, drugs treatment for the curing TB disease. Then symptoms of this disease is cough near about, first one is the cough near about the 3 weeks. Near about cups carry 3 weeks. Then weight loss, night sweats, swollen lymph nodes, chest pain, and hoarseness. These are the different symptoms of tuberculosis. This is about the TB, that is tuberculosis. In this tuberculosis, new complications are found. First one is the multi-drug resistant TB. That is, we take the number of antibiotics but not response properly, not to cure the disease properly. So multi-drug resistant TB, this is does not respond to drugs that are currently used. Then mostly seen in immunocompromised persons and immigrants, and still many drugs available to treat this. Then extensively resistant TB, that is XDR-TB. XDR-TB is the extensively resistant TB, that is resistance to the two most common antibiotics plus two injectable antibiotics. The number of two antibiotics used and injectable antibiotics also used. This is the extensive resistant TB. About 4% of the MDR TB are now XDR TB. It is 4% of the MDR TB, multiple drug resistant TB, turns into the XDR TB. Still, it still is treatable and not more infectious. Treatment carry on and more infectious not found. These are the new complications found in the TB, multi-drug resistant TB and extensively resistant TB. Then pertussis. Pertussis is the whooping cough. Pertussis is highly contagious bacterial disease that cause uncontrollable and violent coughing. always we cough, patients cough, coughing and coughing, not controlled properly. Then initial symptoms similar to found as a common cold, usually they develop about a week after exposure to the bacteria. Pertussis is a very common disease in a near about found in a youngest one as well as the old people. But this is the very violent coughing, and initial symptom is symptoms is the common cold. This is the pertussis. Then seasonal influenza. This is a viral infection that spread easily from person to person. Three types of seasonal influenza A, influenza B, and influenza C. The only type A and B are included vaccine. Influenza A and influenza B have the uh, vaccines. Okay. Then transmission of this influenza is droplet produced by coughing and poor hand hygiene. Coughing and poor hand hygiene. And how to prevent this disease? By hand washing, regular hand washing. Then equity means cough equity means it is used to describe the infection prevention measure to decrease the transmission of respiratory illness. That is, we use always tissue paper or handkerchief and cover the mouth by hands whenever we coughing or sneezing or talking. Then mask the patient, use the mask or wear the mask on mouth. Then seasonal influenza vaccines, we use the patients give the patients sorry different influenza vaccines provided to the patients. These are the preventions of the seasonal influenza disease. Then vaccines available in the market. There are many different types of the vaccines available. Those who healthcare considered as a high risk. Okay, then there are the two types: trivalent and the quadrivalent vaccines. In trivalent vaccines, it is to protect against the influenza, that is influenza A, that is the H1N1 virus, that is that contain the two influenza A and two different influenza A virus and one influenza B virus. This vaccine contains the influenza 2, influenza A virus and influenza B virus. Then in quadrivalent means the two influenza A virus as well as the two influenza B viruses. These are the two vaccines present in the available in the market. Then signs and symptoms of this influenza disease is fever, chills, cough, sore throat, running nose, muscles or body ache, then headache, vomiting, diarrhea. These are the symptoms of influenza disease. Then Ebola. Ebola means hemorrhagic fever. This virus spread. This fever is caused by the Ebola virus, and this virus spread by the direct contact with the body fluids such as the blood of an infected human or the other animals. And this virus load is the highest when the patient had just expired. Patients have Ebola disease, then whenever these patients expired, then the virus load is highest. Then sign and symptoms is typically start between the 2 days and 3 weeks after the contacting the virus. Early signs and symptoms include the fever, sore throat, muscle pain, and headache. And later signs and symptoms include the vomiting, diarrhea, rash, bleeding internally and externally. Early symptoms, they have the two symptoms: early symptoms and the later symptoms. Early symptoms include the fever, sore throat, muscle pains and headache, and later symptoms include the vomiting, diarrhea, rash and the bleeding internally and externally. After 21 days, if a exposed person does not develop symptoms, they will not become sick with the Ebola. Well, after 21 days. This is about the Ebola disease. Then it is a no specific approved FDA Food Drug Administrative vaccine for this virus is available. Exact vaccine not available in the market for this Ebola, although a number of potential vaccination are being studied. We studied this, the research going on the going on finding the vaccine of Ebola. Then people who care for those infected with Ebola should wear the protective clothing, including masks, gloves, gowns, and goggles. Okay, the virus is able to survive on object for the few hours in dry state and can survive for a few days within the body fluids. The virus have the ability to survive on the object and survive on a body fluids. Both of these. This virus survive on liquid as well as the solid. This is the about Ebola disease. Now last is the coronavirus and COVID-19. We we have already known about that the coronavirus and COVID-19. This is a rapidly spreading coronavirus that is SARS-CoV-2, severe acute respiratory system coronavirus 2, and this is it causes the COVID-19. It is responsible for the million of infections and the hundred of thousands of deaths globally in 2020. And information on coronavirus or COVID-19 is being updated as it spread, usually updated now till the date. Okay. Then coronavirus causes COVID-19 is not generally considered to be the airborne, and there may be some situations trusted the source in which the virus can act like as an airborne disease. Then the SARS-CoV-2 is spread through the respiratory droplets after a person cough or sneeze, and but these droplets are larger than what is considered airborne. And the most common symptoms of this COVID-19 include the fever, cough, fatigue, and shortness of the breathing. That is, the patients have the problems in breathing. Okay. And whenever we found any patients as have a symptoms, fever, cough, and fatigue, as well as a breathing problem, then see a doctor immediately. Then airborne diseases usually result in one or the more of the following symptoms. We have seen the number of diseases, but most of the diseases have the similar symptoms. Symptoms are inflammations of your nose, throat, sinuses, or lungs, then coughing, then sneezing, congestions, runny nose, sore throat, swollen glands, headache, body ache, then loss of appetite, fever, and fatigue. These are the similar symptoms found in the different airborne diseases. Then, how to treat the common airborne diseases? For the most of the airborne diseases need plenty of rest and fluids. Then further treatment depend on your specific illness, which type of the disease then you treat specifically. Then airborne disease such as chickenpox have no targeted treatment. Chickenpox is one of the diseases that have no targeted treatment, but however medication and other supportive care can help relieve symptoms. Then some such as the flu can be treated with the antiviral drugs. Then treatments for the infants with whooping cough can include antibiotic, and hospitalization is often needed. Then the number of the drugs to treat and cure the TB. Although some strains of the TB are drug resistance, we have already seen. Okay, which are the multiple drug resistant and XDR, that is extensively drug resistant. These are the failure to complete the course of medicine can lead to the drug resistant and return of the symptoms. If a cough early enough, the diphtheria can be successfully treated with the antitoxins and antibiotics. These are the different treatments for the common airborne diseases. Thank you.